Introduction to CPR. These are the 6 links in the adult out-of-hospital chain of survival. Number 1, recognition of cardiac arrest and activation of the emergency response system. That's going to be calling 911. Number 2 is early CPR with an emphasis on chest compressions. Number 3 is going to be rapid defibrillation. Number 4, advanced resuscitation by emergency medical services and other healthcare providers. Number 5 is going to be post-cardiac arrest care. And number 6 is going to be recovery. That's going to be including additional treatment, observation, rehabilitation, and psychological support.
CPR, or cardiopulmonary resuscitation, can increase your chances of survival by 2 or 3 times. This is something that we use when you come across somebody who is unconscious and unresponsive, meaning you can't get them to wake up and they're not breathing. For this demonstration, we will need a resuscitation mannequin and a pocket mask.
First thing we'll do, coming up to a patient, hey, are you okay? Weren't able to get an answer, patient is unresponsive. Next thing I'm going to do is I'm going to check for a pulse, and that's going to be on the carotid. There's no pulse present. First thing, I'm going to tell my partner, go ahead and call 911, initiate the emergency activation, and check for if AED is available as well. Begin compressions. It's going to be 30 and 2. 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt the head back a little bit to open the airway, and then blow 2 breaths.
We're going to be watching the chest to see if we have adequate chest rise and fall.
When you're doing compressions, the key is to push hard and push fast.
Another 2 rescue breaths. Now we'll be waiting. Once you do have an AED available, you want to go ahead and attach the AED as well. In this demonstration, we're going to be exercising single Rescuer Cpr. This is in a scenario where you are by yourself and you come across an unresponsive patient who is pulseless. So with single Rescuer Cpr, it's going to be compression only CPR. There are no rescue breaths within the scenario.
All right. You okay? No response. Check for breathing. Check for pulse. No pulse. And all I'm going to do is continuous compressions. And this is important. Chest compressions are the most important thing for survival. So if all you can do is chest compressions, that still will increase their chances of survival by 2 to 3 times.
So in single Rescuer Cpr, in comparison to rescue breaths, to compressions are more important because we're looking at regulating blood flow to the heart as compared to oxygen deficiency. So in this demonstration, if you happen to come across a pediatric patient that is unresponsive and pulseless, we're going to demonstrate single Rescuer Cpr until you get someone else to come and be able to help you out as a partner.
Okay, so we come up to an infant who is unresponsive. We check, are you okay? No response. Check for a pulse. You can check under their arm. Check for a pulse, check for breathing. No pulse and no breathing. So you start CPR. Since infants are so small, typically you use 2 fingers. And when you're by yourself, you do 30 compressions to 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8.
You also notice the depth compressions on a pediatric patient aren't as deep as they would be on an adult patient.
27, 28, 29, 30. And then you take your pocket mask, and just like an adult, you're looking for chest rise and fall. Remember, infants have very small lungs, so it won't take a very deep breath. And then 30 more compressions. 29, 30.
And this is the same with adult CPR. You're going to continue compressions along with your rescue breaths until you're able to get an AED or 911 emergency services become available. So in this demonstration, we're going to be doing 2 Rescuer CPR on an infant patient. So the rate of compressions will be 15 and 2. So there'll be 15 compressions as a comparison to 2 breaths as well. So you're going to go through the same steps. Hey, are you okay? Patient is unresponsive. Check for a brachial pulse. No brachial pulse is present. So I'm going to go ahead and start CPR. 2 fingers to the sternum. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 2 rescue breaths. Continue another round of 15 compressions. You still be looking for adequate chest rise and fall with the rescue breaths. Again, we'll be waiting for AED to arrive along with emergency services as well. So in this demonstration, we have initiated CPR in the event that someone is unresponsive and pulseless, which will definitely increase the chances by 2 to 3 times of saving someone's life.